Japan still, but I mean,
Oh wow.
so
So this is your room.
yeah, I'm on like a support vessel for a super yacht that's we're now in Osaka area, yeah, southern Japan for a few days. So keeping me busy.
Wow.
Got a boat full of American guests and some international guests as well.
I
So
mean,
yeah,
our encounter was for only for a few minutes, but when you told me that you're working 4 months of the year full time and then the rest of the year is just a volunteer service, I was just
correct.
blown away by it because I've never seen
Yeah,
such a medical doctor.
yes, that's what I'm doing. So it's cumulatively 4 months a year, but it's actually like there'll be 1 week here, 3 weeks there, 2 weeks
Oh,
throughout the year, and then
oh,
yeah, and I sort of this is how I get funds to keep our projects going, and I raise funds here to send to our projects all over the world, so and to
mm.
keep help keep our clinics open, and so we have a core group of donors that maintain our clinics, and then this is add-on funding to, expand our services. So that's how we work. So yeah,
Well,
bit of a
I'm so blown away by that kind of idea because most people I know that want to become doctors, they don't become doctors to help people. They want to get rich. But
look.
like,
It's a common problem.
yeah.
Jerry, I found one thing. Once you start doing humanitarian work, it changes the way you think. You sort of realize what it's about because um, it's you realize the value of service, and like it's quite addictive.
Wow.
You realize how far money really goes in terms of saving people's lives,
That's true.
and it sort of reordered my priorities. Like we all are materialistic. We all tend in that direction. We all struggle with, society's expectations, and you know, our value system is entirely dictated to by just our society around us. And it's a fight, especially in Western countries. Materialism is a big deal. But like once you expose, Jiro, once you expose to people that are just trying to survive, it changes you. Like you realize what's really important, and it's not stuff or not prestige. It's about the value of human life, and the ability to reach out to people and make a difference. So that's sort of I've reordered my trajectory of life. It's sort
So,
of a different approach to life, I suppose, but it's valuable for me. It's changed my life completely. Yeah.
but have you been always like this, or did something hit you at one point?
You know what happened? I grew up in Africa. I'm from South Africa, and I've lived in a developing country my whole life, which was a good start. I went to medical school and we worked in poor communities in Cape Town, in the slums around Cape Town, and you deal with impoverished communities a lot, and it changes the way you think about things. And but then my whole humanitarian focus started in 2015. I had this urge to get involved in more charity work. Um, and the earthquake in Nepal in 2015 happened, and I happened to be off of work at the time, and I just flew myself to Nepal and went to our Adventist hospital at Shea Memorial Hospital and joined up with a local team, and we did clinics up in the Himalayas, in remote villages, busy caring for injured people from the earthquake in 2015. And it left such an impact on my mind, just reaching out to people who'd lost everything, and to be able to make a tangible difference with a small budget, but to be able to save them from infections, from medical complications. It was just mind blowing for me. It was really a moving experience, and since then I've never stopped. So it's been quite a game changer for me.
That's crazy because that's when
Yes.
I think stopped teaching for an Adventist school and then I
Okay.
started my own business. So how long you volunteered
Yeah,
for
10 years. This is
8 months?
my
Yeah.
11th year now. So
Yeah, we've been I mean I've been running my own business for 10 years and you've been
very.
helping people for 10 years.
But look, I also my corporate work is a business too. So I generate funds through this project and keep my life paid for. But as I say, like I'm blessed in a way to be able to be in an environment that's opened doors to get quick funding, to be able to and to have lots of time off, to be able to devote most of my year to voluntary work, which is great. Um, Everyone's scenarios are totally different. And ministry comes in many different forms. You don't have to do one way or the other. It's more a state of mind than an actual situation that you're in, or whatever. But Um, but the work has changed the way I think, changed the way I've lived, and it's for the better for me personally. It's been an immersion that's really changed the trajectory of my life. I can tell you quickly. So after Nepal, um, there was a group that I sort of teamed up with. Who started a new organization called Adventist Help. It was a group from Switzerland that was affiliated with ASI, and they started doing refugee work in Greece because they were facing the Middle Eastern refugee crisis with thousands of refugees moving into Europe from war-torn areas of Syria. And we started a clinic on the island of Lesvos in eastern Greece. And it was that was after Nepal. And we set up a bus clinic right on the beachfront where boats were arriving, these little dinghies, packed with dozens of people, many old ladies and men and children and women who'd walked all the way from Syria, from Afghanistan, from Iran, and they were asylum seekers and refugees who faced immense suffering in these conflict areas, and they were coming to Europe to try and apply for asylum. And it was an incredible experience for us. It was our first clinic, and there were thousands of people coming by boat, and every few hours, boats would capsize in front of us, people drowning. In the mornings, bodies would be washing up on the beaches, and we'd be doing resuscitations of near-drowned children on restaurant tables in the fishing villages in the north
Wow.
coast of Greece, and it left such an impact on us. It actually was the start of a brand new organization, and that's the organization we run today. It's called Advent Relief, and basically our focus is we're trying to expand the reach of Adventist humanitarian medical work. As a church, we're very strong on lifestyle, we're very strong on education, and ADRA also does beautiful humanitarian work around the globe. But we don't have a strong humanitarian medical focus. We have good Adventist hospitals, but they are not they're hospitals you pay to go to. They're not hospitals that are set up in conflict areas and crisis areas, and and we really need to be there. And it's been our challenge as Advent Relief, our charity organization we've set up, is to push the work into regions where we haven't had a footprint medically. So, for example, we work in dangerous locations. We're very active in eastern Ukraine at the moment. We've been working there for 3 years. We've been running clinics right near the eastern front line. We work in the south. We look after orphanages. We've been doing dental clinics. We've been working with villages that have been destroyed, and it's an area of intense need. People who've experienced immense suffering, and we to be able to reach into these areas as Adventist medical workers, it's a blessing. It really is a blessing to be able to reach out and do what Jesus told us to do, and that is to reach out to those who are suffering and to help get them to find healing and to give them hope. So the work has just exploded. After Greece, we're now active in we've been active in the country of Moldova, running refugee clinics. We're active in Ukraine, running refugee clinics. We've been in the country of Iraq, which is deep in the 1040 window, for about since 2018. And our clinics have seen thousands of patients in Iraq. We run the only health service in the entire region for internally displaced persons. That's our domestic refugees, and they're mostly women and children and elderly people who've escaped from ISIS in large camps near the city of Nineveh, Jonah's Nineveh. Um, and we're the only SDA presence in that entire area, and we've been able to treat literally thousands of people.
Wow.
That clinic is active right now as we speak. They're busy seeing patients who escaped from ISIS, the war against ISIS in 2017. Many of them are women who were held as sexual slaves by ISIS soldiers. The children running around the camps are the product of rape. Many of them, and extremely vulnerable population groups. And to be able to be there as SDAs and to be able to say, hey, we're providing you with healthcare, we're providing you with mental health care, we're providing you with emergency care. It's a privilege. It's a privilege. I never dreamed we'd be in places like that.
Wow.
Um, our biggest project, though, is with ADRA. We're currently working in Uganda. And if you know a bit about Uganda, Uganda is a country in East Africa that's surrounded by countries at war. So to the north is South Sudan, one of the most dangerous places on earth at the moment, and to the west is the Democratic Republic of the Congo. And in this region, we have our biggest project, and that is where we've been running a clinic with ADRA Uganda and with Ishaka Adventist Hospital for the past 2 years. And I can tell you, it's a camp of 250,000 people. Most of them are refugees from the Congo who've escaped from a life of absolute hell. Eastern Congo is a region that's racked with sectarian violence and with militia groups that go around um, killing people and burning down villages. It's one of the highest, the most concentrated regions for sexual violence against women and children. So most of the patients in our clinic have experienced are rape survivors, and they've fled the country of the Congo because they've got nothing left there. So we provide a primary health service and antenatal clinics for pregnant women. We provide a counseling service for survivors of gender-based violence and sexual violence. We do vaccination clinics for children. We do nutrition clinics for children with malnutrition. And we're very excited because we've opened up a brand new 10-bed inpatient area to manage children with severe malaria. So the biggest killer in this region is actually severe malaria, and the mosquitoes are killing thousands of people every year. Malaria is a very dangerous disease, especially the falciparum malaria in East Africa. We've had children dying in the waiting rooms while they wait to see the doctor just a few weeks ago, and so now we have this inpatient area. It's the first Adventist refugee hospital, as far as I know, in the entire sub-region, sub-Saharan Africa, and um, we wish we could just replicate it because the need out there is. We're trying to expand the work and reach more people, but the clinic is seeing 36,000 patients every year, so on a tiny little budget, and so we're very excited to be able to do this work in East Africa, um, and we have our eyes on future projects. We're looking at Lebanon to partner with ADRA Lebanon for Syrian refugees. We look. Um, we look with longing at Gaza. We know we can't get in there now, but if the opportunity arose to get into Gaza, we need to have an SDA presence there, busy reaching out to people who are suffering. So that's what we're about as an organization. We're a small group, but we are very motivated, and despite our inadequacies, we've managed to make quite a big footprint in the humanitarian sector in some pretty nasty areas.
You
Yeah,
know, you
so that's
know,
it.
I've been living for myself for a long time, and just hearing you talking about humanitarian work with so much passion just really humbles me, and then it's just really
Well,
is making me
we,
very
we,
emotional.
listen, we all live for ourselves. That's just our natural bent. Me too. I think for me, what changes me is getting exposed to people who are suffering. It changes the way you think. It changes your priorities. It changes how you allocate your money. It changes how you allocate your time. Like I was sitting next to a little boy in our waiting room of our clinic in Uganda a month ago, and I sat next to him. This child has got marasmus, severe malnutrition, and he's got a bloated belly he's got a massive spleen from getting recurrent malaria, and he's so anemic. He's so pale, because he's had such bad malaria. He needs a blood transfusion. And I just sat there next to this kid. I just thought, wow, what a privilege that we can actually treat this child and help him to get better and help him with nutritional rehabilitation. The previous month I was in eastern Ukraine. We were running a clinic at an orphanage, um, jam-packed with brand new orphans from the Eastern Front. The parents are dead or taken as prisoners of war, and these children sit there in these orphanages and they've got nothing. They have hardly any food. And a little boy said to me, he said, he told me he doesn't know where his parents are, and his mother and father had both been taken as prisoners of war. They're somewhere deep in Russia, and he probably will never see them again. And I just sat with him, and he just cried, and it just changes what's important to you. Um, it makes my hair stand on end just thinking about if we hadn't done this, how many people would have been dead. So for me, it's not really about us. We don't even feature in this whole thing. I'm trying to encourage a movement in our SDA circles, a movement towards humanitarian medical. We have one of the biggest health networks out of any church on the planet. Okay, and we ADRA does incredible work. I see they're moving into healthcare as well. I'm just saying our footprint in healthcare, humanitarian healthcare, needs to be bigger. Um, where we really reach out to people who are suffering, because it's such an important way to reach out to people around you. The need is enormous. In developing countries, in war zones, in conflict areas, in areas of natural disaster, healthcare is such a way to reach people, and it doesn't cost that much. Um, so I'm just trying to push that message in all the circles I interact with, when I travel around in various churches, and I just say, hey, we can do so much more. And I looked this morning, ADRA's just opened a mobile clinic service for Venezuelan refugees in Colombia now. And it just made me so happy to see that we're reaching out in healthcare. We have the capacity, we have got the manpower. We just need the motivation to really push this one. Yeah. So I hope we can see more clinics opening. Seventh Adventist refugee clinics, Seventh Adventist clinics in war zones, in conflict areas and crisis areas where we can really reach out to people who need it the most.
And just
Yeah.
talking to you at that time when you visited Korea for a short time, and then just talking to you,
Yes.
it seems to be just transforming my entire life right now. So, what did
Yeah.
you do before 2015 then as a medical doctor?
So say I missed that last bit. There was a bit of a
So in 2015, what were you doing as a
so
medical?
I in 2015. So I've been working in the private sector. I I I work for a big international organization that it's a corporate medical, and I was working for big companies in the mining sector, in oil and gas, in countries like Papua New Guinea, Myanmar, Vietnam, West Africa, Nigeria, all around the world. I was doing remote site medical services for big corporations, and you know, I still do work like that to sponsor our refugee work, but it's just a means to an end now. The whole money making world and corporate sector, it's empty. I just see it as a tool to pay for my living expenses, but also but to fund my humanitarian work. And that's why I'm doing yachting work at the moment, because it's a perfect tool for me. I enjoy the work, but it gives me enough time to be able to devote most of my year to charitable work. So I work 9 months of the year as a volunteer, and then 3 months a year I get an income. Um, and I found a way to make it sustainable. It's everyone can find their own way, but it's more about a mindset, as I said, than an actual situation. It's more a spirit of service that we all need, that I need. And yeah, for me, it's just been a privilege to be involved in it. I'm blessed to have been exposed to the right people at the right time, to have been able to go down this route. And I want to just share the happiness and the blessing that comes from that other people do the same. That's really what
Yeah,
it is.
yeah, you
Yeah.
sound like one of the happiest people I've ever met recently.
It does make you happy. Like serving others does make you happy. It definitely does. Like you realize how empty life is without service. It does change things. It's changed me. Yeah, and
I
I know
mean,
many other people who've worked with us has too.
I run a language institute. I work with only Adventist teachers, and I'm trying to
Yes,
have this mindset of Christ. But I've been just paying bills. I've been trying to just trying to
we
survive.
all have. We all have. I've been doing the same. It's just since I've started this work now that it's changed my thinking. We all have the same. We're in a battle for survival in the world these days. It's just to get by and to, you know, care for our families and to make ends meet. You know,
Exactly.
it's a challenge, and I'm not saying everyone's got to give up their jobs and go spend 9 months years volunteering. It's more just a state of mind. It's how you treat the beggar that you meet outside the shops when you go to town. It's how you treat the old lady crossing the street in front of you. It's you how you manage a homeless child that's on the street next to you. It's more a state of mind than an actual place. You don't have to go to Ukraine to find the people that are suffering. They're in the hospitals around you, they're in the old age homes, they're in the childcare facilities, they're in the orphanages, they're everywhere. And even wealthy people who seem like they've got their worlds together, they need help too. So it's being human, it's a universal human issue, and if we as SDAs can be there and be known as the people who care, it would change everything. It would change everything. So that's my mission, and yeah, I just hope we can just replicate this kind of work everywhere. That's my dream for us. That we can do more.
So how
Yeah.
did it get started and how did it grow, like step by step?
We're still a small organization, but basically what happened was we started the clinic in Greece. We were at the right place at the right time to get visibility from many media groups, and that visibility got us quite a big volunteer network. So we work with volunteer doctors and nurses and administrators from around the world, SDA, non-SDA, from any walk of life, and they join our team and they immerse themselves in refugee work. And the project just gained momentum. If you're in the right place at the right time, you get the visibility, the right doors open for us. We were really blessed. Um, and we managed to connect with the right donors who have been really blessed us with enabling us to do more financially. Um, it's still it's still a struggle to try and keep everything paid for. Um, but we step out in faith quite a lot, and as I say, we all put our own funds into keeping these projects afloat. Sort of like the tent maker kind of model that they use that talks about in the New Testament. Like we have our other jobs, and then we take a portion of our proceeds and put them into the work, a significant portion of it, and that's how we sort of keep it sustainable. But the work has expanded dramatically, and our connections with organizations like ADRA, who do incredible work around the globe, has been wonderful. And we've had such good interactions. We've worked closely with ADRA in 3 different countries, and it's been amazing to sort of add a medical dimension to the already spectacular work. It's been a privilege, and I really look at groups like ADRA and say, hey, I wish we could do more with them. We're exploring options in places like Lebanon now, and in the Middle East and places like Iraq to see if we can add a medical component to the already well-established and well-respected humanitarian work. And yeah, it's getting there.
So how many countries and how many people are involved in this work?
So we've been working, I think, in 7 countries now. 7 countries. We're starting a partnership with a group in El Salvador, in Unidad Médica Adventista. They do similar work to us in the country of El Salvador, looking after poor communities. We're active in Ukraine with a team there. We have a team in Iraq, a team in Uganda, with ADRA Uganda and with Ishaka Adventist Hospital. And then Lebanon, we're sort of looking at Lebanon with ADRA Lebanon. And we're, as I say, we're looking at other places too. I would ideally like to have a stronger emergency response team that we could deploy into conflict and crisis areas, for short-term missions, to be able to reach out to areas that really need short-term care, especially in natural disasters and in conflict, in areas of conflict. We could be doing so much more. Something we talk a lot about, the 1040 window and the challenges of the 1040 window. And I always smile when we talk about the 1040 window. I look at Iraq. The 1040 window is asking us to come there, but they're asking us to come with healthcare. We always think, oh, it's so challenging working in that. No, no, it's not. They're actually asking us. Iraq was the easiest place to set up clinical work out of all of our projects. And we literally saw thousands and thousands of patients from the city of Mosul, who would have otherwise died, many of them. Children with severe malnutrition, people who just experienced significant trauma, people with chronic diseases that hadn't seen a doctor in years, rape survivors, people with untreated diabetes. The range was enormous, and with a relatively small budget, we were able to see thousands of people in the 1040 window. And it's not as inaccessible as people think it is. It's an area that needs help. They really need help, and we can really be of blessing in even places where the SDA presence is not very very big. The health work is what is a universal need, where we can have a major impact in reaching out to people and helping to relieve suffering. So yeah, that's what keeps me in the business. That's why I'm
Wow.
on this boat today, to try and do more. That's really what it's about. So right now I'm networking. We're trying to open a malaria laboratory in Uganda. So that's why I'm on this boat now. I'm fundraising for malaria. It's trying to open a lab so we can better manage children who have severe malaria, who have kidney failure, who have cerebral malaria, so we can help them live. And like that little boy that was sitting in the waiting room with me. So that's why I'm here right now. That's my next project, and
Did,
I'm off to Lebanon in 3 weeks' time to look at projects there too. So that's sort of, we just keep it moving.
did you say you're in a boat?
Yeah, I'm on a boat. I'm on a boat right now. Yeah.
So like who is driving? Like who is like driving
No, it's a yacht. It's a
the yacht?
120 meter yacht, very big. Yeah.
So
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 I work on there. Yeah, for a few months a year. Yeah.
so that's a yacht where you're there as a doctor to take care of the people that may have needs that arise.
Yeah. So I look after. So the way I fund my refugee projects is I look after wealthy people on their super yachts for three
Ah,
months a year. These are high
oh,
net worth. They're wealthy people from all around the world. I work on their boats to provide private healthcare, and then quite often they sponsor our projects. They'll donate funds
wow.
to specific projects, and then I just use my payslip from working on here to keep projects running as well as some kind donor support that we get from donors in the United States and in Netherlands and elsewhere. So
Wow.
yeah, that's how we keep things running. Yes.
Seriously, when I thought of the word yacht, for me, it's a luxurious place where people are having a great time, and then you're there.
No, they look the people above deck that up above me, yeah, upwards. Yeah, fantastic. They're having a great time. I'm below deck. I'm here for work. So,
Wow, like seriously, I didn't expect our conversation to be this deep and impactful. I'm actually feeling almost dizzy because
oh, I'm so sorry.
of
Maybe I
oh,
talk too fast as well. I
no,
make
no,
people
not
dizzy.
because of that, but the how I don't know how unselfish the work is and how fulfilling it is for you, and then it just
Yes,
hearing you just cured my soul, like totally. It just totally
I'm glad. I'm glad.
transformed my perspective for a short time. So how was your childhood? What was your family like when you were
So
growing up?
I'm a pastor's kid. So my parents eventually they both were teachers at Adventist high school in Cape Town, and my brother's also a doctor. Just the two of us, my brother and I, and we're both doctors. We so he works in the island of Santa Helena in the Atlantic Ocean, in a very rural location, and I'm doing the humanitarian sector mostly. But yeah, I don't have what simplifies my work quite a lot is that I don't have a wife and kids, so I'm not static in one location. I move around a lot. But if I was in a different environment, then obviously mobility is not the same. I can't just race off to Lebanon and yeah. So, but I'm blessed in that way to be able to engage in lots of projects because I'm quite mobile. But anybody, no matter what the situation is you're in, it's more, as I said, it's more of a state of mind than a place. And but yeah, it's been a great 10 years. It's been I think in total we've seen over 200,000 patients in the last 10 years. So it's been crazy. That's nearly 250,000 people, with a tiny little group of volunteers working on a shoestring budget. Um, yeah, it's crazy. We're blessed. It's been more of a blessing to us even than to them. So yeah.
I think the parents of the medical doctors will in Korea will probably disagree with the kind of work that you're doing because they think you're not making money, you're not getting all this fame, you're not all this blah blah blah. But my question is like, do you think your parents instill in you a desire to serve people and then just get fulfilled?
Yes, they did. They did. They did. I'm from a family that did charitable work. My grandmother used to run a rape survivor clinic. She's a nursing sister. They used to run rape survivor clinics in Zimbabwe, and my grandfather was a nurse as well. They also used to work in poor communities, busy supporting rural communities. And my dad is a pastor, and as teachers, secondary school teachers, they instilled a humanitarian focus, and they raised us, reminding us that service is what it's about. It really is. It's not about us. It's about what we can do for others.
So
Um,
so your
yeah.
so your parents didn't like what is it? Get worried or like disagree
No,
with you, none of that. So very supportive.
no, not at all. Not at all. In fact, I'm, my folks are coming with me to Uganda next week. Like I'm heading back to Uganda to the clinic. I have epilepsy, so I don't drive very much. I avoid driving, so I'm getting my parents up to come with me to Uganda to help us with the project there. So yeah, they're very involved in humanitarian work. They love it as well. I think growing up in Africa, it sort of changes your perspectives on things somewhat. Dealing with people who are struggling all around you, it sort of keeps your perspectives right. It's very in a way in the Western world or in wealthy communities, it's very easy to forget that there are people out there who are actually having a very hard time just making ends meet and to just have food for today. Um, but the work just shocks you right all the time. I remember like you get very comfortable in the Western life and wealth, wealthy people around you forget. And then I would go back to Iraq, and then you see your patients and they come in with these malnourished children, and you ask them what they've been eating, and they've been eating grass. Do you know, they've been eating grass? My patients were eating grass, and the only protein they get was from eating cats. That was what my patients would be eating. And like severely malnourished children with marasmus, severe malnutrition, and sort of you can't stay the same. When you throw out food, I throw out food. I always feel man, I wish I could get this to Gaza. I wish I could, it's just, it changes your thinking. It's messed me up in some ways. It made it so much better in others. It's like, yeah.
You know,
Anyway,
my dad passed away from cancer when I was in high school.
really,
And then I was very sad. That's when I began to study the Bible. And then, okay, let me get back to church. Let me seek God. And then
yes,
I've seen tons of people being healed from the lifestyle
yes,
center
it's brilliant.
that was
Mm,
run by a lay person. And then I've seen
yes,
hundreds of thousands of people being healed from studying the Bible, mending the broken
yeah.
relationship with God and with people. So I've been very interested in this kind of thing. And so as a medical doctor, I've personally as a son of a patient that died in the hospital and eventually in the Lapsall Center, Adventist one. And then I think he died at home eventually. But anyway, he was sent off from the hospital.
Mm,
I saw
sorry.
a sense of discouragement and this deep sorrow and all these things, and then just a sense of helplessness.
Yeah.
But what is something that you feel as a medical professional that has a different approach to the medical work that other people do not have? What's special about something that you offer to the patients?
So for us, we're here to help bring healing and give people hope. That's what we're about as an organization. Um, people are suffering out there, and we're here to provide a holistic approach to helping them with their disease processes. We're very clinical in our approach in healthcare. We follow evidence-based medicine all the way. Um, but we do focus on lifestyle quite a lot too. It's really important, more as preventative um, uh, processes than therapeutic. But lifestyle education is really important. And as I say, it's a very important big part of our church as well, our health message. And so we do focus on that a lot with our clinical work. But quite often, if we're working in crisis areas and it is limited. Our patients have malnutrition. They have no access to healthcare. They have horrific situations they're coming from. So often it's just about helping them to survive. Um, but more than that, being there for them, and showing our faith by the way we treat people. We demonstrate. We want to demonstrate. You don't always need to talk. You can demonstrate your worldview. It's often a more powerful witness. And that's what we try and do. That's what we're about. We're about serving, and we don't care who you are. We in our clinics in Eastern Ukraine, the people in our clinics who Russian sympathizers who are informants. In Iraq, we have people in our clinic who are ex-ISIS. In Uganda, we have militia from the Congo that are in our clinics that come for treatment who would have been doing atrocities on the Eastern Front. And we say, hey, we treat you because you're human. We value your life, and we're here to help you get through this. So it's a rehabilitative kind of process that we like to institute, helping people to get their lives back together and to also give them hope. That's really what we're about.
So it sounds like you're the head of the organization Adventist.
Advent Relief Medical Care. We're a Swiss charity. I'm not the president. I'm the medical director.
American
Our
director.
president is our president is Mr. Kim Boozle. He's a well-known SDA humanitarian who works very closely with Outpost Centers International, and he's been helping lead our organization for the past few years. But he's based in Zambia, and an American gentleman. We work very closely together, and we start lots of new projects together. It's been a great experience. But we have a team. Each country's got their own country director and a team on the ground, and we use volunteers from SDA and non-SDA community, and we also hire local staff. One of our policies we have is we like to hire refugees to work in our clinics. So we empower the local refugee population to be able to get, and host community as well, to get employment. And we try and find funding to pay them a living wage. And it just makes the intervention so much have such a bigger reach. We actually financially supporting communities while getting the work done as well. So that's one of our approaches, especially in Uganda and Iraq. So yeah, it's been an interesting immersion, very interesting immersion.
So as the director of the medical part, you establish
Yes,
something and then you train people and then you leave and then come back and you check on them and then you that's what you're doing.
correct. So we set up the biggest challenge is identifying the need. So when I go to, for example, Lebanon in a few weeks, we visit the communities with ADRA Lebanon, and We evaluate what the existing services are, what the healthcare service gaps are, and then we try and come up with a simple, sustainable model where we can put together a clinical service at low cost and high output. So that's sort of how we do it. What makes it easier is we're all volunteers. We will all work for free. We get our funding from to pay salaries. Our goal is to get funding to pay salaries for the local hires and to supply medicines and consumables to keep the clinic open and infrastructure. Um, so that's the challenge: trying to get a sustainable system together where we can, you know, provide a clinical service that is effective, evidence based, and covering the right gaps. That's what we do. But quite often we go to places where there is no healthcare, and it's very hard to define where to start them because it's like they need everything, and then you sort of have to decide what is killing them fastest and focus on that. So, for example, Uganda, what's killing the population is malaria. So we've had to taper we had to focus on a really small area, and that is treating malaria. And even which malaria patients are dying, it's pregnant women and children. So our clinic focuses mostly on pregnant women and children. Um, yeah, limited resources. We've had to really decide very carefully on what intervention we're going to do, and that's sort of the challenge we face in the sector, and that's a universal challenge in the humanitarian sector, is how to allocate a limited resource to reach the maximum number of people, and to help them to survive. Um, yeah, when I look at the world news, I mean, Jeremy, there's need everywhere. I just wish we could just clone our teams and just send people everywhere. I look at Yemen, I look at Sudan, I look at Gaza, we look at Syria, even at the moment. Um, it's you look at places like Myanmar, um, look at Pakistan, huge needs, and we really should be there. We really should be there. We just, I think we need to I think it's a matter of reprioritizing, even as a church organization, what our focal points on and what models are we need to adopt in order to reach the maximum number of people. Because we really do need to be there, and that's sort of what the message that I'm pushing is. When I travel to crisis areas like Ukraine, Ukraine's not a good example. In other countries we've been to, like Iraq, um, the people we see working doing healthcare at the front lines, the Muslims are there, charismatics are there, the Catholic Church is there in a big way, um, several other groups, but we don't see enough of an Adventist presence in some of the places I go to, and it's been a burden to me. And I say, hey, we could do more. We could do more, especially in healthcare. ADRA's there. ADRA is beautiful. The work of ADRA is beautiful, but I'm talking in healthcare. Um, so that's sort of what I'm pushing. We're trying to push, expand the healthcare work, the humanitarian healthcare work as a church. Yeah.
Wow.
So yeah, that's what I'm doing.
We have 1 minute left, and then
Yes.
I'm on a free call. So I have
Yes,
just
no problem.
so the South Africa you said is a developing country which I've never heard of. Is it true?
Yes, it is. So while there's quite a lot of wealth in South Africa, it's the wealthiest country in South Africa. In Africa, the there is a significant, because of our history, we have a very complicated history with apartheid. There's significant poverty in many areas, and it'll take years to correct that. But it's a long process. But we hope things move in the right direction faster. But yeah, it definitely is a developing country with lots of challenges, and yeah, we wish we could do more even in South Africa. Yeah, it's there's so much need out there. Yeah.
I'm so thankful that you made time for this. I felt like I was
Yes.
talking to an angel.
No, that's you. That's you. Joe, it's been great chatting to you too. And just one last thing. If anybody's interested in volunteering with us, they can look us up at adventrelief.org. If you're a medical, non-medical, nurses, doctors, dentists, admin workers, truck drivers, if you want to get involved and get to the field, they can